My name is Mari Herscher. I am a doctor of physical therapy. My role is both as a physical therapist and as the FRP lead at the San Leandro Clinic. And what that means is FRP is the Functional Restoration Program. So I'm basically the person that heads the team of, I think we've got like 5 or 6 people that run a program here that does like physical rehabilitation as well as like emotional well-being and like a couple of other modalities kind of mixed in. The most rewarding part of the program, I think, is watching our changes ripple out into people's lives. So as a physical therapist, I'm very focused on the physical part of the rehabilitation. I'm very body focused. Our marriage and family therapists focus more on the mind and on emotional well-being. And we're only with them for a couple of hours a day, but they come to us and they tell us about how their relationships with their family has improved, how they're feeling like they have the courage to go back to work, or that they're going to like start trying new things or come back to hobbies that they kind of lost their ability to do with their injuries. And it's just really beautiful to see people kind of come to life in a new way after these like hard kind of pieces. I think the fact that our team is a team, right? That we're not like a bunch of separate providers that work on these patients in silos, that we meet on a regular basis and talk about what these patients may need, that we adjust the care plan as they go through because people need different things. And though we have a format that we're following, we're able to kind of tailor it to what each person needs. Um, and I also think that we get to develop a really close relationship with the patients because we're with them for so much more time than you would traditionally get as a provider in just a regular outpatient clinic. So we learn a lot more about them and we're able to meet them a little bit more closely where they're at because of that. As a PT, the things that I focus the most on are creating programs that allow people to be more independent. So whether that starts out as me doing some manual work and like helping release things or facilitate kinds of movements that people need to be able to learn how to do on their own. My goal with almost all of the modalities I use is to progress them to a place that the person can take it and run with it, right? So that they don't need me anymore. Um, so I focus a lot of on corrective exercise, postural correction, um, muscle facilitation, and helping people kind of develop a new relationship with parts of their body that they could use more efficiently. As far as quality of life, I think that once people are able to get kind of back into their bodies or they kind of get control back of their bodies, whereas they've been a little bit like at the mercy of their pain level or their strength or their endurance. Once you give people the freedom to use their body as they want to, you start to see them kind of expand in ways beyond just the physical, right? Like you have the energy to do XYZ, and you can kind of like see the way that they sort of take back pieces of their lives that are not just like movement based pieces. I had someone come like all the way through our functional restoration program, which is 8 weeks long. They're here for 4 hours a day. It's all very intense. Um, and I had someone who just really just struggled through it, like had like such a difficult time kind of like getting here and being here, but was really just giving their all throughout it, like despite it being really hard, despite having really tough days, despite having other medical complications. Um, and at the end, the the family of the patient came in with them and told me like, thank you so much for giving us like our mom back. Thank you for giving me my wife back. Um, and she had gone through this program like very quietly, just kind of kept her head down and was pushing through. And it wasn't the reflection from her necessarily, but the reflection from her family that like she'd had this huge improvement, and it wasn't just her seeing and feeling it, it was everyone around her. We have an official meeting once a week where we kind of get everybody together and we talk about things that we have seen or things that have come up for patients, because what a marriage and family therapist sees is going to be so different than what a physical therapist sees. It's going to be different than what a medical doctor sees. So we kind of gather perspectives officially once a week, but the beauty of the clinic and everybody being in the same place is that if something comes up, I can walk across the clinic and find the other person I need to talk to. And like, we kind of exchange a few words, we can form a plan and then enact the plan in the moment, right? We don't have to wait around for like the patient to come back in however many weeks, right? And we can also involve the patient, right? I can like bring people with me and say, hey, this thing is coming up. What do you think? And the patient is allowed to be involved and allowed to give their input and kind of be the driver of their care. And I think that's one of the things that makes what we do here different, because we have so much more time. We have everybody in the same place. We can let everyone have a voice, and there's not the like latency that's really common in healthcare of like the waiting around, the waiting for a response, the waiting for an email. It's all like very live time, and it makes a huge difference, I think, in people's healing timelines and as far as their like their self-efficacy, right? Like I'm involved, I'm a player in what's going on. The biggest driver for me is watching people improve almost in ways that they don't necessarily perceive themselves. So frequently, like I'll challenge someone to do something and there is an initial fear. And usually what I do is I kind of like turn my head away so they don't feel like they're being directly watched. Um, and maybe they don't do it in that moment, but maybe they try it at some other point later on. And like watching people surprise themselves, I think is the best part of the job. Is like when they go to pick something up and they're like, oh, like I didn't know I could do that. Or someone like gets up off the floor or like gets out of their chair like on their own and they're like, whoa, I haven't done that in months, years. So watching people like regain these like things that feel so little to like an able-bodied person, but to them are like monumentous. And they never expected that it was going to come back as easy as it did. I had a patient who had been kind of in and out of wheelchair, had a really hard time getting around, was using a cane, was using a walker, and had this terrible fear of falling. And so that became our focus is like, okay, well, what can we do to work on your balance? What can we do to work on your leg strength? And then what do we do if you're on the ground, right? Like, how do we manage? And after lots and lots of training and lots of coaxing, we finally got her onto the floor and we started talking through like, all right, what's the protocol? What do we do? How do we get you up? And after like an hour of training, which is incredibly quick in the PT world, she got herself under her own power up from the floor to standing. And she looked me in the eyes and she said, I have not been on the floor since like 2013 or something. She was like, I haven't gotten on the floor because I've been afraid that I would get stuck on the floor. And like seeing what changed in her in that moment was really gratifying for me as a physical therapist. I think one of the surprising things is that I decided when I was like, you know, in kindergarten when you scribble like what you're going to be when you grow up, I actually wrote physical therapist. And I waited like my whole like life to change my mind. And I didn't. And so I ended up here and every day I'm so glad that I did stay the course. Another thing I think that maybe is a little less surprising is that I ended up working in chronic pain because I think at some point in high school or college, I had a pretty gnarly rock climbing accident. Ended up with a pretty severe like neck, shoulder kind of nerve injury thing. That because I thought I was going to be a PT when I grew up was like, I'm going to fix it myself. I did not know how to fix it myself. But it kind of spurred me forward on the journey of like chronic pain as a specific piece of physical therapy. And even working in a chronic pain clinic now, like I manage some of my own chronic pain. Like this is an ongoing thing. But I think it's nice to be able to relate to patients and tell them, like, hey, I hear you. Like, I have my own kind of thing going on, and we'll do it together.